I'll share my screen as well. Right, so today we have to discuss about the Unit 3, Human Growth and Development, and we are going to discuss about the Learning Outcome 3, which is understand physical and psychological changes of aging. So I'll start my lecture, and if you have any question, then please ask, and I'll try my best to answer that. So, when we talk about the physical changes of aging, then we can say that aging brings about various physical changes, which include, um, for example, decreased muscle mass and strength. There could be changes in bone density and joint flexibility. There could be decline in sensory perception, such as vision and hearing. There could be skin changes, such as reduced elasticity and increased dryness. There could be increased, like a human can be prone to illnesses such as arthritis or cardiovascular diseases. And if we talk about the psychological changes of aging, then we can say that alongside physical changes, aging can lead to psychological shifts such as changes in self-esteem and self-image. Uh, there could be impact on confidence level due to physical limitations. There could be psychological effects on societal perceptions and ageism. There could be cognitive changes, which includes memory decline and cognitive processing speed. So, when we understand the interplay between these physical and psychological changes, it's vital in providing effective support and care for aging individuals. And by exploring the changes and adaptation associated with aging, uh, we can develop a holistic understanding of how individuals experience and respond to these changes as they grow older. This knowledge can inform the development of personalized care plan and interventions to enhance the quality of life for aging population. If we talk about especially for the field of health and social care. So that was the introduction for this unit and the learning outcome 3. Now we have the indicative content. So in that we have to discuss the physical and physiological changes linked to aging. So as we discussed earlier that aging brings about various physical changes such as decreased muscle mass, alteration in the respiratory system. There could be muscular skeletal issues and changes in skin elasticity. So these changes can impact an individual's overall well-being and quality of life. On the physiological front, aging can affect confidence levels, self-esteem, and there could be um, illnesses as well. So, understanding these changes are crucial in providing holistic care and support to aging populations. Then we have uh, then we have services available to support individuals experiencing changes associated with aging. So, there is a range of services designed to support individuals navigating the challenges of aging, from self-help resources to medical and health services, social care offering, home support, counseling, and community networks. So These services aim to address the diverse need of aging individuals. Then we have effects on self-esteem and self-confidence due to physical changes associated with aging. Physical changes associated with aging, such as loss of independence, changes in mobility, and health issues, can impact one's self-esteem and self-confidence. And it's essential to explore how access to service, community support, and person-centered approaches can help maintain a positive sense of self-worth and independence. Uh, then we have the influence of theories of aging on health and social care provision. So we have principles of mental capacity, establishing consent. So overall, like whenever we have to get the consent from the service user, it's necessary in health and social care. And we can say that theories of aging like social disagreement and activity theory, they all play a vital role in shaping health and social care provision for older adults. And by understanding these theories and principles of mental capacity, consent, self-directed support, and person-centered care, professionals can tailor their services to meet the unique needs of aging individuals effectively. So in the next slide, we have to discuss about the key terminologies. So we have what are psychological changes of aging and what are the physical effects of aging. Uh, there are common health conditions with associated with aging. Um, development does not stop at puberty. Okay, right. So when we talk about physiological changes of aging, so we can say that physiological changes refer to shifts in an individual mental and emotional well-being as they age. So while most older adults maintain good mental health, as a significant portion maybe experience mental health problems such as depression, anxiety. But it's noteworthy that the suicide rate among men over 85 is notably higher than in other age groups. So they have given us the example. And then if we talk about physical effects of aging, so physical effects of aging has changes and challenges that occur in the body as the individuals grow older. Uh, some common physical effects of aging include decreased muscle mass, changes in bone density, and joint flexibility. There could be sensory impairments like hearing loss and vision issues. Um, like we have cataracts. There could be chronic pain conditions like back and neck pain and osteoarthritis. There could be respiratory condition like chronic obstructive pulmonary disease. There could be metabolic disorders like diabetes and neurological conditions, including depression and dementia. So we have all those examples. Uh, then the then we have common health condition associated with aging. So if we talk about that, then there could be health issues that affect older individual, and that impact their quality of life and well-being. So some common health conditions associated with aging include hearing loss, vision impairments. We have given the example of cataract. Um, we have musculoskeletal issues such as back pain and osteoarthritis, respiratory condition like chronic obstructive pulmonary disease. We have metabolic disorders like diabetes, mental health disorders such as depression, dementia. So understanding and managing these conditions are vital components of providing holistic care for older adults. Then we have the developmental stages in adulthood. So development in adulthood basically refers to ongoing process of growth, change, and adaptation that individual experience beyond adolescence. And we can say that adults undergo developmental changes stages that lead to physical, psychological, and emotional changes in their life. And these stages may involve transition in roles, relationships, and priorities, and impacting overall well-being and outlook on life. So if we familiarize ourselves with these key terminologies, we can deepen our understanding of complexities of aging, the challenges faced by older adults, and the importance of holistic care and support in promoting healthy aging and well-being. So, if you have any question, then please don't hesitate to ask. And now we have the 3.1, which is we need to explain physical and psychological changes linked to aging. Okay, so here they have given us uh, information about early adulthood and middle adulthood. So we need to first talk about the physical changes that take place during adulthood, right? So, for example, we can say that physical changes which are linked to aging, especially if we are talking about early adulthood. For example, they have given us the age group of 20 to 35. So we can say that during this period, individuals may experience minimal physical changes in terms of height and weight. Um, Hormonal changes continue, but their effects are less pronounced compared to adolescence. Then we have middle adulthood. Okay, so right. So for middle adulthood, which is they're referring to 35 to 65 years. So this stage marks more noticeable physical changes, including the loss of skin elasticity, fine lines, and wrinkles may become more visible, prompting individuals to consider products like anti-aging creams. The focus on physical appearance, diet, supplements, and weight loss may become more prevalent as individuals strive to maintain their health and vitality. Then, if we talk about the uh, physiological changes linked to aging, and there could be impact on self-esteem or impact on self-image. So as physical changes happen, individuals may experience shifts in their self-image and confidence level. These visible signs of aging, such as wrinkles and changes in appearance, can influence how individuals perceive themselves and how they are perceived by others. There are some societal influence as well. So, societal pressure to maintain a youthful appearance, as evidenced by abundance of anti-aging products and diet supplement that can contribute to psychological stress and concerns about aging gracefully. Media messages and beauty standards may shape individuals' attitudes towards aging and impact their psychological well-being. So, by understanding and addressing both the physical and physiological changes associated with aging, individuals can adopt a holistic approach to maintain their overall health and well-being, and we could embrace the natural process of aging, prioritizing self-care and seeking support when needed can help individuals navigate these changes with resilience and grace. So we have all those examples related with the physical and physiological changes linked to aging. Right. So here in this slide, we have to discuss about the around the age of 65. Okay. So as individual transitions into a late adulthood around the age of 65, they experience more pronounced physical changes that can impact their overall health and well-being. So we can explain the physical changes associated with late adulthood based on the information which is provided to us. So if we talk about late adulthood and the physical changes, so then we have the um skin changes. So, uh, so as individual enters late adulthood, we have the noticeable skin changes, and that include the development of wrinkles and age spot. These visual indicators of aging are a natural part of aging process and reflect the passage of time. And then we have decline in physical function. So reaction time may slow down, and the eyesight got weak, and we may use the glasses, and these changes can affect daily activities and may require adjustment to maintain independence and quality of life. Then we have some key physical concern in late adulthood. For example, loss of bone mass. So uh, we can say that one significant concern is the loss of bone mass, which can lead to osteoporosis and increased risk of fractures. Uh, Maintaining bone health through proper nutrition and exercise is crucial in late adulthood. Then we have cognitive functions. So another important aspect is the potential decline in cognitive function. Um, and there are issues related to memory loss, reasoning, and decision making may become more apparent. Cognitive stimulation, social engagement, and brain exercises can help support cognitive health in late adulthood. Then we have some other health concerns, late adulthood is also associated, we can say that is associated with an increased risk of conditions like arthritis, heart disease, diabetes. So these health issues require careful management through a balanced diet, regular physical activity, and access to appropriate medical care. Then we have to we have how do we manage late adulthood physical changes. So while aging related changes are inevitable, and we can say that symptoms can often be effectively managed through lifestyle intervention and medical care. uh, Proper nutrition, regular exercise to maintain bone density and muscle strength, and ongoing medical monitoring can help individuals navigate late adulthood with improved quality of life and well-being. So, understanding and addressing these physical changes and the associated concerns in late adulthood can empower individuals to proactively manage their health and aging process, and ensuring a fulfilling and healthy lifestyle as they age gracefully. Here we have to discuss the psychological and emotional development. Okay, so in early adulthood, individuals experience significant emotional and psychological changes that shape their development and sense of self. So we can say that uh, we have we have importance of early adulthood in emotional and psychological development. We have some key life decisions. Early adulthood is a crucial stage where individuals make important decisions regarding career path, living arrangements, and personal goals. So these decisions impact their sense of direction, independence, and self-identity as well. And when we talk about finding identity and independence, so as individuals navigate this period, they strive to establish their place in the world, gaining independence and making choices that shape their future. The consequences of these choices can significantly influence their self perception and emotional well being. Then we have relationship formation and intimacy. So, developing intimate relationships and relationship forming is a central aspect of early adulthood development, and requiring individuals to understand and define their independent identities for a successful relationship growth. Forming intimating connections can be challenging as individuals learn to balance their personal needs with the dynamics of partnership. Then we have marriage and family formation. So early adulthood marks the time for individual to commit to long-term relationships such as marriage and starting a family. The quality of these relationships plays a vital role in shaping emotional and psychological well-being as individuals seek fulfillment and support in their personal lives. Then we have impact of relationship success on well-being. So if we talk about the emotional well-being, then the success of forming healthy relationship in early adulthood is closely tied to emotional well-being, and nurturing intimate connections and family ties can enhance individual sense of fulfillment, security, and belonging as well. Then if we talk about the psychological development, so achieving a balance between personal growth, independence, and forming meaningful relationships, they all contribute to psychological development and self-discovery in early adulthood. So, mm, if we recognize the significance of early adulthood in emotional and psychological development, So individuals can prioritize self-exploration, relationship building, and personal growth to foster a strong foundation for well-being and fulfillment in the transformative stages of life, and embracing the challenges and opportunities of early adulthood can lead to a deeper understanding of oneself and meaningful connection with others. Okay. So as an example, let's imagine the difference in the emotional and psychological state of the following three scenarios. Okay, so here we have some scenarios. So uh, the first one is Bob, 27 years old. So if we talk about the emotional state, so Bob is highly focused on his career and achieves success in his job, which likely brings him a sense of accomplishment and pride. So, and however, his busy schedule leaves little time for personal relationship, which could potentially leading to feelings of isolation or lack of emotional intimacy. And what psychological state or the effects will happen? So we can say that while excelling in his career can boost Bob's self-esteem and confidence, but the lack of balance with personal connection may result in feelings of loneliness or unfulfillment in that aspect of life. And finding time to nurture relationship outside of work may be important for his overall emotional well-being and satisfaction. Then we have the scenario for Shirley, 33 years old. So, if you talk about the emotional state, so Shirley, as a mother with two young children, faces the challenges of single parenthood after her marriage did not work out. So, despite the separation, maintaining a supportive relationship with her ex-husband may offer comfort and stability for herself and her children. Then, if we talk about the psychological state, so Shirley's ability to maintain a positive relationship with her ex-husband showcases resilience and adaptability, which can positively impact her mental well-being. Balancing co-parenting responsibilities, personal growth, and emotional healing from a past relationship requires emotional strength and self-care strategies for maintaining psychological well-being. Then we have Joe. Okay, so Joe is 30 years old. Uh, for the emotional state, we can say Joe married with a uh, Joe is married and she has a son and attending community college, who is attending community college and embodies a sense of dedication to his family's well-being and his personal growth through education. The balance between family responsibilities, work, and education may bring about feelings of pride and fulfillment. Uh, his son, an 11-year-old son. Right. So if we talk about the psychological state, so we can say that Joe's commitment to his family and education demonstrate his prioritization of long-term goals and personal development. By balancing these responsibilities may lead to feelings of um, a purpose and contributing positivity to his psychological well-being and sense of accomplishment. Then overall, we can say that each individual's emotional and psychological state is influenced by their unique circumstances and relationship and personal goals. So, when we understand the complexities of their experiences, that could allow us to appreciate the diverse challenges and strengths that shape a person's emotional well-being, and it could be in different stages of life. So, as a health and social care uh, worker, we need to understand these concepts. Now we have to discuss about later adulthood. Okay, so late adulthood, we can say, is a stage that brings a unique set of emotional and psychological changes marked by a mix of gains and losses. So, if we talk about, for example, gains and losses in adulthood, so when we talk about the gains, so late adulthood offers the freedom of retirement, grown children, and potentially very few responsibilities. There could be opportunities for leisure, relaxation, and pursuing personal interests. Uh, on the other hand, if we talk about the losses, so there could be concerns about declining physical health, mortality, and the potential for social isolation is there, and the individual the sense of loss of meaningful activities and relationship can contribute to feelings of depression and loneliness as well. Then, if we talk about the emotional strain, so late adulthood individuals are at risk, and they are at greater risk of experiencing depression and loneliness. It could be due to the loss of activities and relationships that once provided meaning and purpose in their life. Then there are mitigating factors, maintaining family bonds, friendship, and remaining active in the community are crucial factors in promoting positive emotional and psychological well-being during late adulthood. So these connections offer support, companionship, and a sense of belonging that can help counter feelings of isolation and sadness. Then we have role of social connections in late adulthood. If we talk about family and friendships, so building and nurturing relationship with family member and friend can provide emotional support, companionship, and an opportunity for social interaction that is vital for mental well-being, and it's very important in late adulthood. Then we have community engagement. So, staying active in the community through social groups, club, volunteering, or other activities fosters a sense of purpose, belonging, and social connection, which can mitigate feelings of loneliness and enhance emotional resilience. So, by prioritizing social connection, maintaining active engagement in the community, and cultivating meaningful relationship, individuals in the late adulthood can enhance their emotional and psychological well-being, and embracing opportunities for social interaction, staying connected with loved ones, and participating in activities that bring fulfillment and joy, all can contribute to a sense of purpose and vitality in later stages of life. Now we have 3.2, explain lifestyle choices associated with aging. Okay, so as individual age, lifestyle choices play a critical role in maintaining overall health and well-being, particularly in addressing age-related changes in different body systems. So if we discuss about the cardiovascular health, so what age-related changes could happen? So aging can lead to stiffening of blood vessels and arteries, causing the heart to work harder to pump blood efficiently. And the adaptation of heart muscles to the increased workload result in minimal changes to resting heart rate, but diminish heart rate or the elevation during physical activities could happen. There could be risk of cardiovascular problems. So these changes lead to a potential risk of developing high blood pressure and other cardiovascular issues such as heart disease and stroke. So managing cardiovascular health is essential for reducing these risks and maintaining overall well-being. Then we have lifestyle choices. Um, if we do the regular exercise, if we engage in physical activities like aerobic exercises, walking, or swimming, so all these support heart health and it improves circulation and help manage blood pressure as well. Then uh, we have uh, the ability to manage stress as well. And then if we talk about it, so effective stress management techniques like mindfulness meditation, yoga, or relaxation exercises are vital in reducing stress levels, which can positively impact heart health. We could have regular heart or health screening. So if we monitor the blood pressure, cholesterol level, and other cardiovascular markers through routine medical checkup, that could aid in early detection of potential risk and appropriate management. So if we incorporate these lifestyle choices, individuals can actively support their cardiovascular health, reduce the risk of cardiovascular disease, and enhance their quality of life as they age. So, prioritizing regular physical activity, heart healthy diet. If we follow the stress management strategies and timely medical checkup, so all these empowers individual to take charge of their cardiovascular well-being and overall health in the aging process. Okay. Here we have to discuss about bones, joints, and muscles in the digestive system. Okay. So, as individuals age, certain lifestyle choices are key to supporting the health of bone, joint, muscles, and the digestive system. So, if we talk about the bone, joint, and muscles, so for bone health, aging leads to a decrease in bone size and density, making bones more prone to fracture and increasing the risk of osteoporosis. Muscles also experiences a loss of strength, endurance, and flexibility, impacting coordination, stability, and balance. So, if we talk about the lifestyle choices for bone and muscle health, we have weight-bearing exercises. Engaging in weight-bearing exercises and strength training can help maintain bone density and muscle strength, reducing the risk of fractures and falls. If we take care of nutritious diet, so if we say consuming um, a proper amount of calcium and vitamin D through foods or supplement, it supports bone health, and a balanced diet rich in protein, fruit, vegetable, and whole grain is essential for muscle function and overall health. Then we have regular physical activity. So staying active through regular exercise help muscle flexibility, strength, and joint mobility. and it could promote overall physical well-being. Then, if we talk about the digestive system, so uh, here they have given us the example of constipation. So, age-related changes in large intestine can lead to constipation in older adults. Factors such as inadequate exercise, low fluid intake, and diet lacking in fiber can contribute to digestive issues, and certain medication and medical condition like diabetes may also impact bowel health. Then, if we talk about the lifestyle choices for digestive health, so we need to uh, drink sufficient fluids and maintaining a diet high in fiber from fruits, vegetable, whole grains, and legumes can promote regular bowel movements and alleviate constipation. We could do physical activity, and the physical activity stimulates bowel function and aids in maintaining digestive health. Incorporating exercise routine like walking, cycling, or yoga can benefit overall digestion. Then we have medication review. So, uh, consultating, if you consult the healthcare provider to assess and adjust medication that may contribute to constipation, can help manage digestive issues and support gastrointestinal health. Then this also was related to this slide. So in the next slide, we have to discuss about bladder and urinary tract and memory and thinking skills. Okay. So if we talk about the bladder and urinary tract health, so there could be age-related changes. So aging can lead to decreased bladder elasticity, causing increased frequency of urination. Weakening of bladder and pelvic floor muscles may result in incomplete bladder emptying or urinary incontinence. So in men, factors like prostate enlargement can further contribute to bladder issues. If we talk about the lifestyle choices for bladder health, um, so we can have pelvic floor exercises. So practicing pelvic floor exercises known as Kegel exercises can strengthen bladder muscles and improve control, reducing the risk of incontinence. We have to, if we maintain a healthy weight, um, it can reduce the strain on the bladder and may improve bladder control. If we avoid bladder irritants like caffeine, alcohol, and certain medication, can help manage bladder issues and reduce urgency and frequency of urination. Then we have memory and thinking skills. Okay, so for that, if we talk about the cognitive changes, the aging brain may undergo changes that result in minor effects on memory and cognitive functions. Older adults may experience challenges like forgetting names or words, or find multitasking more difficult compared to their younger years. So, if we apply the lifestyle choices for cognitive health, so we have mental stimulation. So if we engage in mentally stimulating activities such as reading, puzzles, or learning new skills, that can help maintain cognitive function and support the memory. If we talk about the healthy lifestyle, so a balanced diet rich in antioxidants, regular physical activity, quality sleep, and stress management can promote brain health and cognitive function. We have social engagement as well. So maintaining social connection, participating in hobbies, and staying mentally active through social interactions can help preserve cognitive abilities and memory. Yes, we have to discuss about eyes and ears and teeth. Okay, so if we talk about eyes and vision, so there could be age-related changes. um, Aging can lead to difficulty focusing on near objects, sensitivity to light, and cloudy vision due to conditions like cataracts. Uh, so these changes may impact daily activities and visual activity as well. Uh, for the improvement of these issues, so there could be some lifestyle choices for eye health. For example, we have regular eye exams, so we need to schedule regular eye examination to monitor changes in vision and detect age-related eye conditions early. We have to wear sunglasses with UV protection to shield eyes from harmful sun exposure and reduce the risk of age-related vision issues. We have to consume foods rich in antioxidant, omega-3 fatty acids, and nutrients like vitamin A, C, and E to support eye health and reduce the risk of age-related conditions. Now, if we talk about the ears and hearing, so hearing may diminishes while with age, leading to difficulty hearing high frequencies or following conversation in a noisy environment. We can say aging can affect hearing and affect daily communication and social interactions as well. So, what are the lifestyle choices for ear health? So, we need to use, for example, earplugs or earmuffs around loud noises to prevent hearing loss and protect ears from damage. Uh, we could undergo regular hearing screenings to monitor changes in hearing and address any issues early. Then we can limit exposure to loud sound and maintain ear health by avoiding excessive noise levels, and that can contribute to hearing loss over time. Then we have to discuss about teeth. So uh, aging may lead to gums receding from teeth, and there could be dry mouth caused by certain medication, making teeth and gum more vulnerable to decay and infection. So dental care become even more crucial, and in age-related issues, it's more crucial in maintaining oral health. So what can we do in lifestyle choices for overall like oral health? We can have regular dental checkups. So we need to schedule routine dental visit for cleaning, examination, and early detection of dental issues. Then we have hydration and oral hygiene. So we need to stay hydrated to combat dry mouth and practice good oral hygiene by brushing, flossing, and using mouthwash to prevent decay and infection. Then we have to avoid or limit sugary food and beverages. We need to consume a diet rich in calcium and vitamin rich food for strong teeth and gums. So, if we adopt these lifestyle choices, we can actively support our eyes, ears, and oral health as we age. Okay. Here we have to discuss about Skin and weight. So for the skin, as individual age, skin undergoes natural changes like including thinning, decreased elasticity, and increased fragility. There could be reduction in fatty tissues beneath the skin, can lead to easier bruising. There could be decreased oil production, which could make skin drier, leading to the development of wrinkles, age spot, and skin tags. Uh, there are some lifestyle choices for a better skin health. We can say hydration. So drinking an adequate amount of water hydrates the skin from within and helps maintain its elasticity and suppleness. We need to use sunscreen and wearing protective clothing shield like the shield the skin from which could protect us from the harmful UV rays, and it could help in preventing premature aging, wrinkles, and age spots. So we have some skincare routines. So if we maintain a consistent skincare routine with moisturizer, anti-aging products, and gentle cleansing, it could help nourish and protect aging skins. We have weight. Okay. So aging is associated with a decrease in metabolism and making it easier to gain weight if activity levels remain unchanged. So, decreased physical activity coupled with unchanged dietary habits can lead to weight gain. So, we need to implement some lifestyle choices for weight management. For example, regular exercise. So, engaging in physical activities such as strength training and cardiovascular exercise, um, it could boost the metabolism and help maintain muscle mass. Um, we need to consume a balanced diet rich in fruit, vegetable, lean protein, whole grains, and low in processed food and added sugar. So it could support like weight control and overall health. We also need to be mindful of portion sizes, eating until satisfied rather than full, and avoiding mindless snacking can prevent overeating and support weight management as well. This is the merit criteria. We need to discuss the effect that physical changes associated with aging have on self-esteem and self-confidence. Okay, so uh, as we age, the decrease in skin elasticity and the appearance of wrinkles can lead to feelings of self-consciousness and reduced self-esteem. So, external signs of aging may alter one's perception of physical attractiveness and affect self-confidence. So, there could be illnesses and limitations. So, health issues that come with aging can lead to limitation in physical activities, uh, causing individual to feel less capable and confident. Chronic conditions or illness may impact mobility, independence, and overall self-image, which could contribute to a decline in self-esteem. So there are some cosmetic procedures and self-confidence related things. So some individuals may consider cosmetic procedures as a way to address physical changes, um, boost their self-esteem, and regain confidence. Procedures like cosmetic surgery or non-invasive treatment can help individuals feel more confident about their appearance. There are feeling of uncomfortable or self-conscious in social setting due to physical changes, and it could lead to social anxiety and isolation. Then we have to discuss about some strategies to boost self-esteem. So we could apply the self-care practices and engaging in self-care activities like skincare routine, healthy eating, exercise, and relaxation technique can promote overall well-being, and it could boost self-confidence. And if we seek therapy or counseling, it could help in individual address underlying insecurities, negative self-esteem, and we can also practice positive affirmation. So focusing on strength, and we need to cultivate self-acceptance, and it would like overall foster a positive self-image and enhance our self-esteem. Here again, we have to discuss about the uh, hearing and loss of vision. So in that, like we can say, as individual age, changes in hearing and vision can have a profound effect on their well-being, self-esteem, and independence. So there are some causes of hearing loss, like age-related hearing loss can be attributed to various factors such as earwax buildup, nerve sensitivity, or exposure to loud noises over time. It can lead to difficulties in communication, misunderstanding conversation, and feeling left out or frustrated in social situations. There are some emotional challenges. Hearing loss in old age may result in individual feeling like a burden to others, experiencing frustration and self-perceived isolation. Also, the communication barriers can lead to lower self-esteem and confidence, potentially causing individual to withdraw from social interaction and feel disconnected. There are effects of vision deterioration on self-esteem and independence. So, age-related vision changes can make simple tasks challenging and hinder independence. Inability to see clearly may lead to feelings of frustration, decreased self-confidence, and limitation in carrying out daily activities. There are loss of independence as well. So vision impairment can impact one ability to drive and navigate their environment independently. It affects their sense of freedom. There are loss of independence can further contribute to decline in self-confidence and emotional well-being. Then, uh, if we talk about supporting self-esteem and independence, so communication and support, open communication with loved ones, friends, and healthcare professionals, along with seeking support services like hearing aids or vision aid, can help individuals overcome these barriers and enhance communication and regain confidence. There are some adaptive technologies like utilizing assistive devices, technologies, or tools for hearing and vision impairments can help individuals maintain independence. It improves their quality of life and boosts self-esteem. If we talk about emotional well-being, so engaging in activities that promote emotional wellness, um, seeking therapy to address feeling of isolation, of low self-esteem, and maintaining social connection play a crucial role in enhancing self-confidence and overall well-being. So, by recognizing the emotional and practical challenges posed by hearing loss and vision, in aging, individual can seek suitable solutions, support system, and adaptive strategies to maintain independence, boost self-esteem, and foster resilience in managing these changes effectively. So here we have the 3D one, the distinction criteria. We have to evaluate the influence of lifestyle choices have on aging. Okay, so we have discussed 5 stages of the aging process. Okay, so um, if we evaluate the lifestyle choices in relation to the aging process, it involves recognizing the influence these choices have on overall health, well-being, and the lifestyle factors can impact on how individual age physically, mentally, and socially. So if we talk about the biological aging, so we have physical activity. So engaging in regular physical exercise support cardiovascular health, muscle strength, and bone density, and it helps to reduce the risk of age-related condition again like osteoporosis, heart disease, and um, then if we talk about nutrition, so a balanced diet rich in nutrients like antioxidant, fiber, and protein, it support healthy aging and better cognitive function and immune system function. So proper hydration and limiting processed food can also contribute to better psychological health. We have to prioritize sleep and restorative rest support, mental clarity, immunity, and overall physiological functioning, aiding in organ repair and recovery process. Then we have the physiological aging. So if we engage in cognitive activities like learning new skills and challenging the brain with puzzles or game can support cognitive function, memory retention, and emotional well-being. We have to adopt. We have to adopt. We can say uh, we have to adopt some stress-reducing practices like mindfulness, meditation, or relaxation technique. All it all helps like manage physiological stress, promoting mental resilience and emotional balance. So we have to maintain social interaction as well, fostering relationship and participating in community activities it support mental health, prevent social isolation, and cultivate a sense of purpose and belonging. So participating in social activities, volunteering, or joining clubs or groups. What it does, it nurtures the social connection, it combats loneliness, and enhances emotional well being in late adulthood. Then we have a support system. So, having a strong support network of family, friends, or community resources, it promotes mental health, emotional support, and provides a safety net for individuals as they age. Then we have the physical environment like access to age-friendly environments, transportation option, and healthcare services. These all contribute to social engagement, mobility, and overall quality of life in later years. So So, by making informed lifestyle choices that prioritize physical activity, nutrition, mental stimulation, stress management, social connection, and access to support system, individual can positively influence the aging process across biological, physiological, and social dimensions. So, pro- proactive measures in promoting healthy aging through lifestyle adjustment can enhance overall well-being and quality of life as individual progress through the aging stages. Yeah. So here we have to discuss about some lifestyle changes. So, for example, if we talk about eating a healthy diet, so a balanced diet filled with colorful fruits, vegetable, whole grain, lean protein, and healthy fats. It provides the essential nutrients our body need, and we need to encourage ourselves to choose nutrient-rich food over processed options. And we have to engage in regular exercise and physical activity not only keeps our bodies strong but also uplifts our mood and energy levels. So we need to find activities that we enjoy and aim for consistency to reap the benefits of regular exercise. We need to avoid tobacco and other drugs. So smoking and substance abuse can accelerate aging and harm our overall health and well-being. So we need to make informed decisions to stay away from these harmful substances. Then if we talk about maintaining a healthy weight, so we need to strive to achieve and sustain a healthy weight through mindful eating and regular exercise. Portion control and balanced nutrition play a crucial role in maintaining a healthy weight. Then we have establishing healthy sleep habits. Okay, so quality sleep is essential for overall health, and we need to create a soothing bedtime routine. We need to ensure a comfortable sleep environment and maintain a proper sleep schedule for proper rest. Then we have moderate alcohol consumption. Okay, so uh, moderate alcohol consumption may have some benefits, and excessive drinking can harm our health and accelerate aging. Mm, So we have to be mindful of alcohol intake and we need to set limits. Then we have staying mentally sharp. So we need to engage in activities that challenges our brain to maintain cognitive function. We need to explore new hobbies. We need to learn new skills and keep our mind active to stay mentally sharp. Then we have intentional socialization. So we need to cultivate meaningful relationship with family and friends to support our emotional well-being, and social interaction and a strong support network are vital for healthy aging. So here we have the references. So that means we have come to the end of the slide. So this was all for today's lecture. So if anyone of you have any question, please do ask.
Yeah, hello. Hello.
Any questions, student?
Yeah, hello. Hello. Hello?
No question. Right. So today we discuss about the important indicative content and some key terminologies which are related with the unit 3 and specifically with the unit 3 LO3, which is to understand the physical and psychological changes of aging. So that was all for today's lecture, students. So I'll see you next week with the learning outcome 4, and then uh, after that we will discuss about the assignment brief as well. So till then, take care everyone. Thank you. Bye.
Yeah, bye.
Stop the
Bye-bye.
recording.
Bye. Bye-bye.
Bye.